Back. Indeed, they say cleanliness is next to godliness. Perhaps that's the more reason why all Ghanaians must join government in achieving the best sanitation for their country. Indeed, water is something we're also going to be analyzing today. However, the main priority for the conversation this morning is the report that has just been brought out by WaterAid. They call it Off Track, Off Target. This is aimed at addressing or bringing to bear the challenge Ghanaians are expected or currently expect or currently go through with regard to sanitation and water supply in the country. Why investment in water, sanitation and hygiene is not reaching those who need it most. It's exactly what we're going to be analyzing this morning. And with me in the studio is Dr. Afia Zakiya. She's a country rep of WaterAid. I also do have Ibrahim Musa, no new person to my set. He's the head of policy of WaterAid as well. Maybe first of all, we should be getting to understand why it's been themed off track, off record. You're welcome, ladies and gentlemen.
Thank you.
Thank you.
All right, so let's get to understand first, maybe from you, Ibrahim Musa, even though they say ladies first.
Okay, equity and
Yeah, thank you very much. We christened the report Off Track, Off Target, basically because investment is not getting to the areas that we need it most, and also off track because many countries in sub-Saharan Africa and Ghana in particular is off track in meeting the sanitation MDG. For water, a lot of people say we are on track, but for us in WaterAid, our emphasis is also on equity, even if we are on track to achieve water MDG, but we are calling for equity in the provision of water.
Is that to say that there's a massive endorsement on the part of WaterAid that for water, it's clear that the future is bright?
Yeah, somehow we can say for water, as far as Ghana is concerned, we are, and maybe many countries in sub-Saharan Africa, we are doing better. But like I said, for WaterAid, our emphasis is on equity in ensuring that all Ghanaians, not just a segment of Ghanaians. For instance, if you talk about Accra, talk about areas like Choco, talk about areas like Medina, talk about the Nima, the Mamobis. All people, irrespective of color, whatever, must have access to water 24 hours a day.
Right. Let's get to understand that your report, we're talking about off track, off record, actually wholesomely packaged water and sanitation, or it actually divided them. Is that, so to speak? I mean, sanitation, you said we might not meet. Water, currently on my side, water, you say we might meet. But your report didn't elaborate, so did it?
Well, yes, the report is actually a study of 6 countries in Africa that was conducted starting in 2009 through 2010. And what it looked at, Ghana was one of the countries that was part of the case study. So the report looks at the progress that has been made in both water and sanitation sectors, in the subsector. And what we find is that, yes, while many countries are on track for meeting the MDG for water, for sanitation it's a different story. So the report looks at why is that? What are the challenges that government faces, that donors face, and what are the roles that different players who are involved in the wash sector, what we call the wash sector, what should they be doing, and what should the priorities be? And as Ibrahim was saying, how do we ensure that those who live in the most marginalized and deprived communities are reached with services?
But Doctor, prior to this conversation, I had the chance to speak to so many policymakers in the water and sanitation industry who have argued that they haven't had the chance to cite your report, and they have also questioned the methodology of this report. What was it?
Well, essentially, the methodology had to do with secondary data we package in country and across the other 5 countries like Ethiopia, Madagascar, but we also did some kind of data collection in country. For instance, in the case of Ghana, we had to look at investment records, of government, and donors, and pull them together, to be able to make this. And I give you one particular scenario in the report. For 28 the percentage of GDP 208, that was assigned or that was spent on water and sanitation was 0.38. For 2010, it dropped from 0.38 to 0.29, and that is significant if you consider the number of lives that are lost, especially for children, as a result of poor water. And I tell you that globally, every day, WHO report indicates that 4,000 children lose their life as a result of unsafe drinking.
No doubts about that, but many people have also argued that there has been a massive improvement in the water sector, especially in our part of the country.
Yes, we're not disputing that there have been improvements in the water sector. The issue is the water clean? Is it safe? And is it going to more people in an equitable way? We have still disparities of access to clean, safe water in rural areas versus urban areas, rich versus poor. And so we have these different kinds of disparities that even though water is improving, everyone is not benefiting from the improvements.
Now, I spoke to the Ghana Water Company Limited this morning, and the answer they quickly had to this was that obviously you do not expect a clearer equity, take into consideration that population at various areas in the country actually differ. For instance, in Accra, Alaji, Tabora were all non-existent until lately, so we definitely would expect that equity be quite imbalanced.
Yeah, Ghana Water Company is a bit right, and for us in WaterAid, in our advocacy activities, we keep hammering this point that much as Ghana Water has a mandated responsibility to provide water, in terms of planning, all state institutions must support Ghana Water. For instance, as a human being, you cannot just get up and go and be building your house anywhere, anytime. You must ensure that you work properly with the Lands Commission. You must ensure that you work properly with other agencies so that Ghana Water Company will know your location and be able to factor you into their planning. So they are right if they say that they have these challenges, and we accept that challenge. But as a matter of fact, what we are also calling for is that if you take the issue they are mentioning, Ghana Water Company has suffered for lack of investment all these years. We know there are demographers who do our population planning, and they tell us how our population will grow. Government has a responsibility to release the needed financial resources to replace obsolete equipment that Ghana Water Company is operating with for the past years. And that is the point WaterAid we are making.
But civil society has also blamed it on the duplication of institutions with regard to water or the water sector. Do you think that has played a major role in dragging development with regard to the water sector at all?
Duplication of institutions. In what way?
Duplication of institutions that are supposed to spearhead the free flow of water. For instance, we had the Ghana Water, we had Aqua Vitens until they were removed.
Okay.
Yeah, for instance, if you take the case of Aqua Vitens, they were brought in, to partner with Ghana Water Company, in terms of management contract to deliver water, and they had specific contractual agreements. One of them was to reduce unaccounted for water. At the time Aqua Vitens contract ended and government did not renew it, significant achievements were not made in reducing unaccounted for water. And we are where we are because a lot of the poor areas, in Accra and other urban towns, Tamale, Wa, Cape Coast and what have you, are still struggling to get potable water.
All right, so I would want to believe that that's it for water, because even though inside off track of record, I didn't see that much of an impressive clause that has hailed the water sector. We're now agreeing that the water sector is getting impressive according to WaterAid representatives right here in the studio with me. We're talking about sanitation here. That one has been bluntly pronounced as possible that we will not reach the 2015 MDG we all are looking out for. But in the same vein, some people have had the argument that the sanitation is gradually picking up in the country. We see clean areas, even though some people think we still will not be able to battle it out. The Accra Metropolitan Assembly, for instance, recently has partnered Zoom Lion to ensure that there's an ambassador to spearhead the smooth implementation of laws that would ensure a clean city. Do you think much is not done? I'll come to you on this, Doctor.
Well, I think when we look at the numbers, it's showing Ghana is showing 13% coverage or achievement in improved sanitation services across the country. So that is a number that is definitely needs some improvement. I think what we also have to look at in terms of sanitation, we can do comparisons. Earlier this year, we had the Africa Sanitation Conference in Kigali in Rwanda. And when I was there, one of the things that you notice right away is the clean environment in terms of just the streets and the country itself. You don't find the black polytank plastic bags, trash and everything like that. So that's one area of sanitation. You have the environmental sanitation, but when you look at the coverage in terms of toilets and household facilities, we have the challenge of continued open defecation in Ghana, in many parts of the rural areas and in the north, and even in Accra, even in the urban areas. You find that there are still not enough public latrines and toilet facilities for people. You have, as Ibrahim was saying, people will build a house, but they won't put toilet facilities there. So we have these kinds of challenges, and so it will call for people working in the housing development areas, people doing planning, to step in and address the issue.
But Doc, as much as possible, don't you think the blame on this should not have a measure or a chunk on the investments on the government? It has more to do with attitudinal change. Open defecation. Ibrahim comes from the north. He perfectly would understand what I mean. Seriously, there are people who do have toilet facilities in their home, but would prefer the fresh breeze out there when you're defecating and won't use it. That again brings up to us the issue of attitudinal change. So must the government be blamed for this?
Well, government has the responsibility to provide basic services such as water and sanitation services to its people. That they cannot abdicate to anyone, not to civil society, to private sector, or to donors. We can work in partnership to help them achieve it, but they are the duty bearers in that instance. But certainly we have the issue of behavior change that we need to look at. And one of the things that's commendable in terms of what the government is doing is the adoption of community-led total sanitation, which in and of itself is an approach that requires looking at or addressing people's attitudes about sanitation and hygiene, and looking at ways to make improvements in that area, because if not, the issue of diarrhea and children, 4,000 children, as was mentioned, dying from diarrhea, and that is becoming one of the largest killers of children in Africa. So we have those kinds of issues, but the health impact, the connections between improved sanitation and hygiene, and the links towards with improved health are something that we need to make those connections for people that can help to motivate them to change their behaviors.